Hi, my name is Dr. Peyman Laghaee, my office from Tustin, California. And today for the first time we're shooting this video, and this is because of my great friend who is also my patient, happens to be my patient, and he's right now behind the camera. You can see me, but you cannot see him. And he basically said that let's shoot a video so we can reach more people with the back pain, assuming that he got a result from his treatment. So he wants to share this with the people that they have back pain, back issues. And I'm here basically to pinpoint few things for you so you can help yourself. People that they're suffering from the back pain, they know how uncomfortable, painful, and annoying is. And it's one of the areas that is very difficult to treat and to manage for both doctor and the patients. So today, we're going to focus more on the lower back area, okay? And I want to teach you the things that you can do, like I said, for you. Before we start this, in order for you to help yourself, you need to understand a little bit about the anatomy and biomechanic of the lower back, okay? And I don't know the person who's watching this, how much background you have, but I'm going to assume that we're starting with the beginning, okay? So I want to go over a little bit about the biomechanic first, then it will be easier for you to understand how you can help yourself, okay? So what I'm going to show you is the spine, okay? And our spine is made of 24 vertebrae, okay? As you can see here, these 24 vertebrae, they stacked one on top of each other, okay? And they are divided by 3 regions. So we have 7 of them, which makes cervical spine. Then there's 12 that make mid-back or thoracic spine. And then the last 5, they make lower back or lumbar spine. So medically, they call it cervical, thoracic, and lumbar, okay? And today, like I said, we're going to focus only on the lower back area. So the lower back is made of 5 vertebrae, okay? So I'm going to put my hand here so you can focus on the lower back or the lumbar region. Now you have 5 vertebrae with a 5 discs in between them, okay? And there's nerve roots, spinal nerve roots exiting from the holes which is made between these 2 vertebrae, okay? They call them IVF or intervertebral foramen. Over here, if I turn this here, then this is the pelvic cavity. I want to make sure that you see the whole thing here. Okay, this is called pelvic cavity or pelvis. Now we have 3 bones here, okay? So we have one bone here, it looks like a butterfly. My hand here, they call it ilium. This is another bone called ilium. Of course, you don't need to know the names, but I'm just showing you so basically you get a good background. And then they're separated by this bone, triangular bone, they call it sacrum. So you have ilium, and sacrum. And as you can see, your lower back, these 5 vertebrae, they sit right on the sacrum, on the pelvic, okay? So does that make sense that if somebody has a back pain, low back pain, we should focus also on the pelvic cavity? I mean, to me it does. Because if we are going to treat here, especially with a patient with a disc herniation, and we completely ignore this area here, we're never going to get a result. Why? Because if any of these bones is misaligned for any reason, if there's imbalance here, guess what's going to happen here in your spine? So they're going to be crooked too. Of course, everybody, when we stand up, our eye level is 100% horizontal. You have never seen anybody walking like this or like this, right? So no matter what goes below here, always your eyes is 100% horizontal. Now, if you have the misalignment in the pelvic, in here, and we know the eyes are 100% horizontal, guess what's going to compensate in between? It's going to be your spine, correct? And mostly the lower back because it's closest to the pelvis. So again, when we want to treat the patients with the lower back pain, we always focus on the pelvic. And also you should do too, because you are your own best doctor. It's between me and you. Who can help you the most is you. So you have to understand the lower back and you have to basically do the work to get the result, okay? So again, this is the pelvic cavity from here. This is where we all born, pelvic cavity through here. And that's the reason a lot of women after giving birth, they have back pain, because when baby is going through here, obviously overstretch these joints right here. It's called sacroiliac joints. Then they start getting back pain. So they go to a chiropractor, which they should, to get alignment, adjusted to be aligned and all that. So now that we understand how the spine is, 24 vertebrae sitting on a pelvic cavity, stacked one on top of each other, separated by disc, and the nerves going through here, and here is your brain, and the brain extends itself through these holes. If you look this way, going all the way down as a spinal cord, and the nerves exiting through these holes, which they call them spinal nerve, and they control the whole body. Okay, so for every organs, from the right side, left side, everything is controlled by this nervous system. And this nervous system passes through the holes that is created by the bones, with two bones. So with understanding this, what I'm going to show you today is I'm going to demonstrate 3 techniques and 3 important stretches that you have to do, not you have to, I recommend you do it, for yourself every day, kind of like brushing your teeth. It's time consuming, yes, it's not fun, maybe you'd rather do something else, but if you want to get well, you have to take the time to basically take care of your spine and your lower back. On the future videos, we can talk about the cervical disc and the other areas. But today, again, we're going to focus on the lower back, okay? So I'm going to show you 3 stretches and 3 techniques that you're going to do for yourself at home. Again, this does not mean that you discontinue your treatment with your physician, with any medical facility that you're attending. We don't want you to stop it. I don't want you to change your doctor or anything, but I just want to give you extra tools that you can help yourself in addition to what you're already doing. Again, at the end, before we go to the next section, the lower back pain can be caused with different reasons. We are talking lower back pain due to musculoskeletal issues. Your lower back pain can be caused with other problems, for example, like kidney stone, other issues that you have to go to your doctor and be examined, and they will send you for MRI, diagnostic examination, to find out what the lower back pain is caused by. That's very, very important that you know that lower back pain. Why do you have lower back pain? That's to begin with. And assuming right now that we know your back pain is because of the muscles, bones, nerves, that's what the subject of today's conversation is. Now at the second part of our conversation, again, we're going to go back to our spine, and we're going to talk about the 3 techniques that, as I earlier mentioned, to help you with the lumbar disc, with your lower back pain. One thing I'd like to bring it up to your attention, that if you have a problem with the lower back, such as disc herniation, as you see here, the disc is being herniated, the lower back muscles where my hands are on both sides, they're going to be very spastic and very tight. People that are suffering from the back pain, they know how painful it is, and it's extremely tight. Now, the reason for that is basically the body's self-defense mechanism to begin with, because it prevents itself from further injuries, things that another injury is going to happen again. So in order to prevent himself or herself from the future injuries, it's trying to protect itself, right? Now we want to relax this muscle, okay? Because as long as it is spastic, it's not going to let this disc to heal, to go back to where it is. So in order to relax it, in the front, you have abdominal muscle, okay? Rectus abdominis. And then in the back here, you have gluteus muscle or buttock muscle. So what we should do is, we should strengthen the lower abdominal muscles here, also the buttock, the gluteus muscles. Because if these 2 muscles are strong, this muscle, lower back, is going to relax and is going to respond well to the therapy. But if the gluteus muscle and the lower abdominal muscles are weak, this is not going to relax. And you can go as much therapy, get as much therapies, but it's going to be very difficult to relax these muscles, okay? So I'm going to show you this exercise that you can strengthen both the gluteus muscles and the lower abdominal muscles, okay? And also will help you to push this disc to where it came from. Okay, so for that, let me demonstrate. It's very simple. What you're going to do here is you're going to lay on your back, face up. Okay, so it's going to be like this. And what I do here is I'm going to start with the left leg. What I do, first I bring the knee close to chest. Now my hands can be in any position, it doesn't matter. And I extend the leg as much as I can. I push with this heel down and bringing the toes on the left hand side close to the ceiling. And I hold it to maybe 30 seconds, depending how much you can. You know, you can go up to 1 minute if you can. Okay, and you're gonna go close to the ceiling as much as you can. As I'm doing this, I'm using my gluteus muscle and my lower back muscles. So I'm making it stronger and I'm pushing the disc back to where it came from. And I'm gonna lower it down. And it's extremely important when you lower it down, you put down your hip very slowly, okay? Kind of like crystal plate, don't drop it once. The other side, first you're gonna bring the knee close to chest, extend it like this, and then go up. And as you see, I'm pushing with this heel down and bringing the toes closer to ceiling. And I'm gonna hold it for like 30 seconds or more, and then gonna lower it down slowly, and then put the feet down. This is one of the most important exercises that you will do to treat your disc. The second one, I'm going to show you McKenzie exercises, okay? So for that, we're going to need our timer. I'm going to use my timer here. I use it, my phone, for 1 minute, okay? I'm going to sit here for 1 minute. And what I do is I lay on my stomach, face up, my elbows goes right under my shoulder, and I set it for 1 full minute. And I'm holding this position for 1 full minute, chin up. And what I'm doing is, besides stretching my abdominal muscles, my stomach muscles, I'm also helping the disc to go back to where it came from. Push it back. You're going to hold it for 1 full minute, like this. And if you want to make it a little more effective, you can also bring your knees close to your buttock, which then you're going to feel more extension. And you're going to hold it for a full minute. And then when the minute is up, after 1 full minute, assuming that you did, you're just going to lay straight down like this, flat, for 10 seconds. So 1 full minute, like that. So 1 full minute followed by 10 seconds stretch, relaxation. So now how many times you're going to do it? You can do up to, I would say, 7 times for 7 full minutes. And the ones on the back, those exercises, to keep it basically simple so you won't forget, do it 4 times. Do it 4 times, each time in the morning or evening, doesn't matter. The other technique that I'm going to show you is the extension technique, that you have a towel that is rolled like this to create extension, okay? Sometimes our patients, we use foams or anything that's going to give extension for the lower back. And the way we do it, where I have pain, I'm just going to put right here in the lower back curve, and very simple, I'm just going to lay right over it, just like this, and just leave it there for 7 minutes. And after 7 minutes, slowly you can come up. Again, depending your comfort level, you can use a foam or roll towel. And if anything that makes you uncomfortable, if it hurts, use your common sense, just simply stop it. So all this that I showed you, see how it feels. Not everything works for everybody. You have to understand that. So if something doesn't feel good, very simple, use common sense and don't do it. So for the last part of our conversation, we're going to go over stretching 3 important muscles which are attached to your pelvic bone ilium. Because if those muscles are too tight, they're going to affect the pelvic. They're going to make it imbalanced and tilt the pelvic, and then obviously the lower back, which is sitting on the pelvic, is going to get misaligned, and your disc is not going to get healed well. Okay. So one of the important muscles is hamstring. Hamstring is the muscle right behind your leg. And about 80% of the patients that they have low back pain, they have their hamstring too tight, okay? And there are different ways to stretch muscles. What I recommend is always stretch your muscles in a seated position, laying down, not standing up, because every time you stand up, those muscles are working, and you cannot really stretch effectively the muscle that is already working, okay? So I have this towel here already rolled up, okay, which I'm going to show you, and I'm going to do this laying on my back like this. Usually guys are less flexible. Our muscles are tighter than women. So if you excuse me, this is how I stretch, or our patients here we recommend. So it's in this way here. As you see, you can hold it with one hand, you can hold it in 2 hands. And then you're going to ask me like how long you hold the stretch. Hold it for about 15. 1, 2, 3, 4, 5, 15, okay? And obviously you're gonna do the same thing on the other side, okay? You're gonna go like this. Sorry. And you're gonna hold this position for about 15 to 20, okay? So this is to stretch the hamstring muscle here, which is attached to your ilium pelvic. Also stretches the gastrocnemius, the muscles right here. A little bit of your lower back and a little bit of your buttock, but mainly hamstring. Okay? All right. And then the next muscle, which is extremely important, and a lot of people just neglect it and don't do it, is the muscles of the inner thigh. Now I want to see how I can stretch it here. I try to basically do it in this space it's given to me. So basically you open your legs, imagine, as much as possible. You use your hands and then you push yourself forward. When you do that, you're going to feel stretching in this area in between legs, because these muscles are attached to your ilium, to your pelvic. Okay, so it's in this sense. But imagine your legs are being wide open as much as possible. Okay, and then the last muscle is the muscle quadricep, the muscles in front of your leg. Now this one, you can stretch it standing up, which I don't recommend it. I recommend laying down, but I just show you so you know it. You grab your heel with your hand, make sure you support yourself. You go like this, you hold for 15 seconds. Your chest in this position straight, and your chin is always up. I recommend always stretching, doing weight, anything. Try to keep your chin up, because when you keep your chin up, your spine is more straight. Less stress on the spine and better nervous system. Your nervous system functions better. Okay, and then if you want to do it laying down, the front muscle, just go like this, and then you grab your ankle with your hand like so, and you hold it for 15. Okay. All right, so far so good. Thank you so much for watching. Hopefully these tools that I gave you, I shared with you, it will be useful for you. I hope you enjoyed it again, and then please, if you used it and you felt better, try to share with others so other people, maybe they can use it too. You know, you can reach other people and get more blessing. If you need anything, we are here to help you. You can more than welcome to contact. If anything I can do, I can be a service for you. Again, don't make this stretching exercise techniques that we went over it substitution for the therapy that you are already getting, but that use this as additional tools. Okay, I hope you feel better. Until the next video.